Ladies and gentlemen, thank you for standing by. Welcome to the Say Hello to the latest breakthrough in clinical documentation webinar. At this time, all participants are in a listen-only mode. If you should require assistance during the call, please press star and then 0. I would now like to turn the conference over to your host, Mr. Jonathan Dreyer. Please go ahead, sir.
Okay, thanks, and thanks again, everyone, for joining today. We've got a really exciting session here to introduce you to a new introduction of a new solution that we have that we just brought to market today. So before we get started, if you do have questions throughout today's session, because of the time frame that we're working with, we're going to ask that you submit those questions through the chat window, and then we'll answer as many questions as we can at the end of the webinar today. So you can use the chat function inside of WebEx, and again, at the end of the call, we'll try to address as many of those questions as we can as we wrap up. So here's a quick overview of the agenda. We're going to take a look first and foremost at a few of today's realities. We'll share some insights into experience that we've had working with clients over the years on the clinical documentation front. Then we'll introduce you to our latest breakthrough in clinical documentation. That's the core of today's presentation. We'll also touch on what this means for existing clients, users of Dragon Medical today. We'll give you a little bit of insight into why Nuance, right? Why Nuance is the right partner on this endeavor. We'll talk a little bit about availability of the solution, and then we'll cover some next steps, give you an opportunity to get more information after today's session, and then again we'll cover Q&A at the end of today's event. So let's go ahead and jump right in and begin. We'll begin by setting the stage for what we're going to be talking about, and we'll do this by exploring a couple of things. We'll look at what doctors and healthcare organizations are facing today at a very high level when it comes to clinical documentation. We'll also briefly discuss what they're looking for when it comes to technology, and then we'll talk a little bit about the types of technologies that are really delivering on those wants and those needs. So it shouldn't be any surprise that doctors have cited frustration related to the time spent on clinical documentation. And the real reality here is that technology many times creates this barrier between the physician and the patient. And it's also clear that documentation can be overwhelming at times, but just how overwhelming is it really becomes the real question here. So to set the stage, here's a few facts that we want to share. Physicians spend nearly half of their day in front of a computer, and in an average workday of documentation, that translates into about 4,000 clicks. So in an average day of documentation, a physician clicks about 4,000 times. So this also begs the question, well, what does that really mean? What does that translate into? So I was curious to see if there was a way to quantify and really visualize just how much documentation doctors are generating. So I had our research team pull some interesting stats from our healthcare cloud platform, and I asked the question, I wanted to know how much documentation did the most active physician in the Nuance cloud generate last year? And the number that they came back with was somewhat surprising, and I wasn't sure what that actually meant at first. So 7.2 million words was the number. And really to illustrate the magnitude of the situation, I wanted to equate that into something that was a little bit more tangible. So if you take 7.2 million words, that translates into roughly the equivalent of 16,000 single-space 8.5 by 11 pieces of paper, 12-point font, standard font, and if you stack those sheets of paper on top of one another, that would tower over 5 foot 3 inches tall. So when you think about it in that perspective, it really puts the overwhelming amount of documentation that physicians are faced with into perspective. So instead of disrupting that workflow, technology should really support the physician and allow them to focus on those reasons they got into medicine in the first place, one of the primary ones being caring for patients. So you take this and then you start to layer on some other things. You look at what doctors are doing, where they're doing it, and how all this is changing. So today, physicians are in more places, and there's some interesting stats to support some of this. On average, the average healthcare professional takes about a little over 12,000 steps a day, which is 2.3 times more than the average adult. And they're doing more things beyond the workstation. So this is supported by the fact that 80% of doctors are using mobile devices to communicate patient data, whether that's part of the EHR or outside of the EHR. They're doing those things on more devices, so desktops, laptops, tablets, smartphones, and now you're even seeing these workflows around smartwatches and other devices. And they're also interacting with more health IT systems, so the EHR, secure messaging platforms, care coordination, population health, clinical reference apps, that list goes on and on. So you take these things, you couple that with the fact that CIOs are also citing portability of technology as a key priority. We have all these things in our daily lives as consumers, but we wonder why should it be any different in the healthcare setting. So doctors want technology to be portable and accessible. Clinicians need to easily stay productive wherever they are, whether they're in the hospital, at the clinic, at home, or on the road. And they really need these tools and the information that supports their workflow for things that they're doing, whether it's inside or whether it's something outside of the patient's medical record. So the last piece of this to kind of cover is to take a little bit of a look into cloud-based solutions for clinical documentation that start to really deliver on the promise for better documentation and also really that ability to free physicians so that they can practice as they see fit. So we acknowledge that physicians are in demand of this consistent high-quality experience for their documentation workflows, and their time is increasingly split between the desktop, between mobile devices, and then again, these new tools that live outside of the EHR workflow. So in the last 12 months alone, we've seen that 35% of physicians on our cloud platform, this is again looking at some of the Nuance data to share, are choosing to dictate patient notes on a mobile device. Again, it's a combination of desktop and mobile. These things coexist, and that the result of that is through the use of voice technology that they're 3 times, and I would even argue greater than 3 times, especially on smaller form factor devices, but 3 times faster and more productive when compared to typing. And then with that combined usage, on average, for every hour of dictation, it's saving physicians 2.5 hours. So again, this is kind of providing a little bit of context for some of what we're going to be talking about today and announcing as we talk about this latest breakthrough in clinical documentation. So with all of that in mind, we want to pivot the conversation and introduce you to this way to make doctors feel better about documentation and then also free them again to practice more as they see fit. And we'll do that by really fundamentally improving how they interact with the EHR and then also how they interact beyond the EHR. And we'll be introducing some new capabilities as part of this webinar today. So we'll give them that focus back, and we'll introduce you to this new foundation for voice-driven clinical documentation. And at this point, this is where we'll ask you to say hello to Dragon Medical One. So the basis of today's webinar is going to be Dragon Medical One, which we're going to dive right into. So we embraced the cloud about 5 years ago, and Dragon Medical One is really built off of those years of experience. So the experience of improving voice-driven workflows for clinicians, optimizing our cloud-based speech recognition solutions, and then really working to expand out our ecosystem of connected applications, right, connected apps into this infrastructure. So when it comes to Dragon Medical One, the experience of this really shows, and you'll see this as we go through a couple of the slides here in today's presentation, but it really boils down to portability, personalization, access, insights, and compatibility. So Dragon Medical One is a secure cloud platform that provides this unified set of documentation solutions for the physician, again, whether they're dictating into the electronic health record or into a growing list of mobile productivity apps. So essentially, what it's doing is it's acting as the cornerstone of our next generation voice-driven platform, all delivered through the cloud. And it's essentially made up of 5 core components. And we're going to talk about these high level, and then we'll dive into a little bit more detail in just a second. So first, you have the Dragon Medical One desktop application. So this is essentially the evolution of our flagship cloud-based desktop solution, Dragon Medical Direct. Next, we'll introduce a new concept, which is the Nuance Healthcare ID, and it's the first benefit out of the gate with voice access beyond the EHR, and more on that in just a minute. We're also going to be introducing Dragon Medical Analytics, and this is the capability for your administrative staff to have access to the data that they need to make those more informed decisions, and then also ensure that efficiency across your clinical end user base. And then lastly, we're going to introduce a set of compatible cloud-based workflow enhancements that are developed by Nuance and then also developed by our partners that work with the Dragon Medical One platform. So let's jump into the first part. We'll take a look at the desktop application. So when it comes to that voice-driven documentation on the desktop and that portability that the CIOs and clinicians are really looking for, this is where the Dragon Medical One desktop application delivers. So it's a lightweight desktop app. It's compatible with all leading EHRs. And it was designed from the forefront with virtualization in mind. So it provides a secure, accurate, portable, cloud-based clinical speech across a wide range of Windows devices. At the top level, it's always available, so it's designed for that speed, accuracy, and flexibility. Again, shared experience across devices. It's easy to install and maintain, so there's no complex configurations, and we offer a lot of installation options that work with the infrastructure that you already have in place at your organization today. So that compatibility with the EHR, and also the support of having these applications or our applications run as true virtual apps, support for VDI, and virtual app deployments. We also offer local installations, which provides even greater flexibility for how these solutions are deployed. So with automatic updates, it really translates into less work for your IT staff and then less hassle for your clinicians. So no speech training required also. Out of the gate, it includes accent detection, sets up the user's personal profile. There's automatic microphone calibration. And then the Dragon Medical One voice profiles continue to adapt and improve over time, but out of the gate, we're ensuring that optimal clinician experience from the start. And then lastly, and most importantly, as you'd expect, it's healthcare compliant. So with the speech-related data, it's communicated over 256-bit encryption channels using TLS protocols, really ensuring that end-to-end security of the platform. So now let's talk a little bit about one of the really unique features of Dragon Medical One, which is the Nuance Healthcare ID. So this new capability essentially puts the power in the clinician's hands, and it gives them the ability to personalize their experience and gain access to new features, new products, and new services as they emerge, whether those are from Nuance or through our broad partner community. So all clinicians that are using Dragon Medical One will have the opportunity to register their account. By doing so, they'll unlock a number of these value-added benefits that are only available to Dragon Medical One subscribers that have a Nuance Healthcare ID. It's a one-time process, so it only requires one time to set up, one click to activate the devices, and then from that point forward, the physicians are ready to go. So one of the first benefits of using this unique healthcare ID is that clinicians can take advantage of speech-enabled workflows in a growing catalog of mobile productivity apps. So for the first time ever, we're really uniquely extending this personalized, this consistent experience beyond the EHR and the capabilities to include apps that physicians use every day, things like secure messaging, care coordination, clinical reference apps, etc. So again, a great opportunity to open up these capabilities to new workflows that the physicians are facing every day. So the process is really simple here. It takes 3 clicks or less to activate speech-enabled workflows in supported mobile applications. So the physician simply browses a catalog, they find the app that they want to speech-enable, and then they click one button. So our inaugural set of apps include secure communication and secure messaging apps from solution providers such as CareThread, DocHalo, Imprivata. And then in addition to this, the Dragon Medical One platform also supports the TigerText developer platform, Tiger Connect, which further allows for voice enabling of care coordination, population health, and telemedicine apps. And then over the coming weeks and coming months, users are going to benefit even further as this roster of mobile productivity apps continues to expand into, again, messaging, care coordination, clinical reference, pop health, medical education, all of these other app categories beyond the EHR. So really exciting opportunities here. We then also want to take a look at some of the new tools that are part of this platform from the administrative side of the house. So with Dragon Medical Analytics, your analysts, other staff can really effectively measure documentation and quality metrics, and this provides both individual and organizational insights so that the leaders at your facilities can really track clinician use, can take a look at efficiency, productivity, and also overall this contributes to really more informed decision making. So you get the ability to maximize adoption across the portfolio of solutions, and then also have ways to improve both clinical and financial outcomes as well. One other thing that's worth noting as well is that Nuance also leverages these same tools to ensure the mutual success with our clients. So a lot of great opportunity here with Dragon Medical Analytics. So if we take another little deeper look at this, The online tool is available through your web browser, and it really offers these dynamic dashboards that display key metrics. So you'll have immediate access to trending data. This is data that is related to your users, to the applications that they're leveraging on this voice-driven platform, how much dictation they're doing, where they're doing their dictation, and it also provides things like peak usage and just general system performance. So you get this really nice trending data that's available at a glance. Dragon Medical Analytics also offers the ability to drill down to the user level and then view utilization statistics. You can also export this data for analysis offline. So aside from how much an individual or group is dictating, in the breakdown of specific apps where they're accessing their speech, there's some really helpful metrics that are included here. And I'll just touch on a few of those now to give you a sense of the type of information that's available to your organization on this cloud platform. So we have things like the accumulative change ratio. So this is a new metric which essentially measures how often recognition results are modified by the user when they're creating their voice-driven documentation. So it measures changes through dictation, example being a physician selects a word and dictates over it, deletion commands, mouse or keyboard edits. All of these contribute, and it really acts as a helpful indicator that allows you to identify clinicians that might be able to benefit from additional training or benefit from discussion about how to increase their efficiency with the technology. So again, it's good indicators to pinpoint potential opportunities for improvement in the system. There's other things too, like auto text and voice commands. These, again, further allow you to identify areas for optimization, workflow optimization on this platform. And this is all really just the beginning. So we're continuing to add and expand capabilities, and we'll incorporate new data from other Nuance solutions and other third-party solutions that leverage our technology to provide this more complete, this more holistic view of all of your clinical documentation investments. And then lastly, let's talk about the final component here, which is compatibility. So I already mentioned that the Dragon Medical One platform is compatible with all leading EHRs, but your organization can get even more from your Dragon Medical One investment with a number of workflow enhancements and add-ons that further optimize that physician productivity and also contribute to positive outcomes for both clinical and financial outcomes. And as part of this, we'll just give you a couple examples of these enhancements that are from Nuance and our partners. So the first one here is Dragon Medical Advisor. Dragon Medical Advisor works with this core platform to analyze notes in real time. It suggests ways to make the narrative stronger to increase ICD-10 specificity, improves case mix index, and then also coding quality and compliance initiatives that it supports. We also have PowerMic Mobile. So this enables clinicians to use their smartphone as a secure wireless dictation microphone, essentially allowing them to dictate, edit, and navigate the EHR on any workstation, so turning any workstation into a dictation station. We also have the Dragon Medical Power Pack. So the Dragon Medical Power Pack is a set of evidence-based content, including more than 600 templates and commands that add that specificity and allow physicians to kind of customize the richness of their content very quickly. We also have Dragon Medical Connect. So this links your on-premise solutions to our cloud platform to enable sharing profiles and personalizations across Dragon Medical One and Dragon Medical Network Edition. And then we also have more than 100 mobile and web-based EHR apps. So these are premium app integrations with voice powered by Dragon Medical, things like Epic Haiku and Canto, Cerner PowerChart Touch, eClinical Works, and eClinical Touch, just to name a few. This also includes EHR applications that leverage our clinical language understanding technology, and that provides that flexibility to create those rich clinical narratives for the patient record using familiar tools like Dragon Medical. But it also converts that key information like problems, meds, and allergies from the narrative into standardized structured data for use in the EHR. So again, a lot of opportunity with these workflow enhancements to further improve the experience. So just to summarize, you can think of Dragon Medical One as the new foundation for voice-enabled clinical documentation. And again, it's made up of a few components. This powerful desktop app that lets you have secure, accurate, portable speech across Windows devices. You have the Nuance Healthcare ID that puts the power of personalization in the hands of the clinician. You have voice access beyond the EHR in a growing catalog of mobile productivity apps, access to trends and detailed metrics so you can optimize that clinician experience, efficiency, productivity, and workflows further. And then it's also that compatibility with the latest workflow enhancements from Nuance and our partners, like the things that we just discussed. So when you step back, and put this all together, it really is more than just a cloud platform. It's more a way to redefine the clinician's relationship that they have with technology. So again, new foundation for clinical documentation with Dragon Medical One. So I know we have a couple of number of clients on the call today that use Dragon Medical, so I want to specifically address what this means for you. So as a user of Dragon Medical, you already understand the power that this technology brings to the human voice with remarkable accuracy, return on investment, and those abilities to contribute to more time to focus on things like the patient and the things that you got into medicine for in the first place. So bringing this professional-grade voice recognition to a cloud platform really gives you that unprecedented capability to further improve how and where you and your users interact with the EHR, right? Whether that be at the hospital, the clinic, the office, home, or on the road. It's a familiar interface. You have the ability to leverage the technology to capture that patient story more naturally, more efficiently, and then also on your terms, whether that's in the EHR or beyond the EHR with that new suite of mobile productivity apps that we're now speech enabling. So from an organization perspective, right, the cloud translates into reduced costs, IT expenses, automatic and continuous updates, so you always have the latest technology at hand, the analytics component, and then that increased EHR adoption through portability and all the benefits of those compatibility with those Nuance and partner solutions that we discussed earlier. So whether you're using Dragon Medical Practice Edition or whether you're using Dragon Medical Network Edition or Dragon Medical Direct, the Dragon Medical One platform offers something unique for you. So whether it's greater portability, greater personalization, more access, better insights, or compatibility that you're looking for, you have that at your hands now. Also, if you're using Network Edition version of our product, the Dragon Medical Connect component can link these solutions to our cloud, and that enables, again, that shared profile and personalization, really delivering that experiential continuity as users move between solutions. So if we haven't convinced you yet that Dragon Medical One and Nuance is the right partner and the right solution choice for you, here's a few things that we want you to consider. First, we're empowering more clinicians, contributing to better clinical documentation workflow at more than 10,000 facilities worldwide. 500,000 clinicians rely on our technology every day, and they're doing this to capture and communicate more than 300 million patient stories a year. So we've really pioneered voice-driven clinical documentation. We continue to lead the industry in areas like cloud-based speech recognition. In fact, with healthcare and all the other markets that we serve, we're powering that voice experience in more than 12 billion connected devices today. In healthcare alone, we're first to market with our clinical speech recognition delivered through the cloud, first to market with our cloud-based mobile transcription platform, first to market with cloud-based computer-assisted physician documentation tools, and then first to deliver these value-added workflow innovations like our ability to turn a smartphone into a secure microphone, or all the innovations we're delivering with Dragon Medical One today. So that, coupled with the fact that we have the most complete vision for voice-driven productivity, we are empowering a broad ecosystem of partner applications that you rely on as well, more desktops, more browsers, more mobile devices that leverage our technology, combined with that freedom to choose and more options for deployment, as well as those benefits that are driven through clients and proven through our client success. So, many reasons that Nuance is the right partner, and you can ensure successful relationship with all our clients here through the use of this technology. So as we're wrapping towards the end of our call, I just want to cover two more things real quick, and then we'll try to address a couple questions. So from an availability perspective, Dragon Medical One will be generally available in April of this year, April 2016. And Nuance clients in North America that are using Dragon Medical Direct will receive Dragon Medical One at no cost at this time. And again, I think there's probably some questions that came in asking about what this means specific to the applications that you have in place today. So we'll try to address those here in just a moment. So as we kind of pull this together, just a few next steps before we try and use the last 2 or 3 minutes to answer a couple questions that have come in. First, if you're interested in getting more information about Dragon Medical One or any of the workflow enhancements that we discussed today, you can visit nuance.com/dragonmedical1, and that'll have all the information you need online. If you want to schedule a one-on-one briefing, you can contact your Nuance account executive, or you can also call the number on screen, which is 877-805-5902. And then lastly, if you're attending HIMSS here in just a week and a half or so, you can schedule a demo to get a first-hand experience of Dragon Medical One. So you can simply go to nuance.com/go/HIMSS2016 to schedule an in-person demo and a briefing. And again, if you have any questions at any point along the way too, you can always feel free to reach us through our contact information on the website on nuance.com, or also by calling the 800 number on screen. So let's answer just a couple questions that came into the chat window. Again, I want to be respectful of everyone's time here, so let's just grab a couple that we can address here real quickly. Let's see. Okay, first one, this is a simple one. So does Dragon Medical One cost more than Dragon Medical Direct? So the short answer there is no. So the pricing and the terms for Dragon Medical One are the same as Dragon Medical Direct. So if you're in the process of working with your Nuance account executive on Dragon Medical Direct, there's no change there for Dragon Medical One other than all the benefits that you receive. Here is a similar question related to that. So are hospitals in the process of purchasing Dragon Medical Direct licenses, and that will be before April? What does that mean for us? So, good question. Anyone that has purchased or is purchasing Dragon Medical Direct prior to the general availability of Dragon Medical One in April will receive Dragon Medical One when you install, if you're doing that after April, after the general availability date, or it will become available as your next upgrade at no cost. So if you install Dragon Medical Direct today, when Dragon Medical One becomes generally available, you'll have access to that. So either way, your investment is protected. That also, again, applies to any clients that have purchased Dragon Medical Direct at any point in the past year. Dragon Medical One becomes your next no-cost upgrade once it's generally available. Let's see, another one here. What exactly are you demoing at HIMSS? I'm going to assume that this is related specifically to Dragon Medical One. So we're showcasing the full end-to-end workflow with Dragon Medical One. We also will have our launch partners on hand at HIMSS to demo their speech-enabled workflows. So we'll be able to give you a first-hand experience of the full suite of solutions related specifically to Dragon Medical One. Let's see, do doctors need to register their ID to use Dragon Medical One? So there's a few components, as we've discussed, that make up Dragon Medical One, and there's a few ways to answer this question. But in short, the Nuance Healthcare ID is not required to use the Dragon Medical One desktop application, but it is needed if a physician wants to extend that speech-enabled workflow to any of the mobile productivity apps in our catalog. So again, short answer on that you don't need the ID for the desktop application, although there are other benefits to link the continuity of that experience for the user, but you definitely need the healthcare ID to extend that down into the speech-enabled workflows through those mobile productivity apps. And then just do 1 or 2 more questions here for time, and we'll also send a follow-up. We'll address some of these questions, and if you do have any questions also post-event, you can also ask those through the various channels that we have here. How do new apps get added to your catalog? So we're working, as I mentioned earlier, with various vendors across these different app segments, and we encourage you also to let your app providers know about the availability of this. So any vendor with a non-EHR mobile app for iOS or Android, they can register to get access to our developer program, and they can enable this speech and get that added to the catalog. So there's no cost associated with that. That's also another piece to mention. So we're not charging anything extra for access to these applications, and also the cost is not there for the developer to do the integration. So we're trying to broaden this ecosystem for all of our users. We also had one more that I see actually just popped up. It kind of jumped in on me here about how do we get a demo? So again, for near term, we can suggest scheduling a briefing using either the 800 number or calling your Nuance account executive or contacting them. And then also at HIMSS, if you will be attending HIMSS in just a week and a half, we'll be doing demos there. So I think we've exceeded our time by about 3 minutes. So again, I want to be very respectful of everybody's time, but hopefully this has given you a little bit more insight into our next generation platform for clinical documentation. And really, again, it's exciting from our side and all of our partner side of what we're able to enable here with Dragon Medical One. So thanks again for joining. We'll collect all of the questions that we weren't able to address on the call today, and we'll provide some follow-up post-event. So thanks again, everyone. Take care.
That concludes our webinar for today. Thank you for your participation and for using AT&T Teleconference Services. You may now disconnect.